To our weekly dementia blog that is hosted by SpectrumEd. We've just now began to work with SpectrumEd to be able to develop clinical trainings now that will soon be available across the spectrum for the caregiver, the practitioners. We're actually covering 8 different areas that we feel is extremely important for everybody involved with battling this disease, from assessment, diagnosis, differential diagnosis of types of dementia, as well as looking at symptom management, pharmacological treatments, as well as actual trainings that are designed for the caregiver themselves. Again, welcome to our weekly dementia blog. My name is Dr. David Hutchings, and we've had a couple of requests come in and lots of feedback. I know that with Facebook and all these things, we've had several thousand views. So we're getting a lot of questions in terms of different topics that people would like to hear about. And this was one topic that was brought up in terms of dementia warning signs. So when we say dementia and we talk about in this blog, we're going to cover dementia as again, the spectrum of all forms of dementia. I used the acronym before in a previous blog, thinking about dementia as an umbrella term, kind of like cancer. We have cancer as an umbrella. We have many forms that fall under that. So same thing here with dementia, many different forms. So let's talk about what are the warning signs. Number one, I will go back and say that even though that you have a family history of it, doesn't mean that you'll acquire the condition. Okay, so and that's for most dementias. Now, some of the early onset Alzheimer's disease, some of those gene mutations are much more aggressive genetically, but for late onset Alzheimer's disease, they're not always genetic. So let's get into some of the warning signs that we see here. And I put together this graphic for us to be able to look at different areas here. And I'm going to get my pencil so we can draw a little bit here and begin to animate this a little bit. So I did put a picture here at the bottom, and I'm going to talk a little bit about this as we go through the warning signs. So this is actually pulled from the Alzheimer's org website. So the great website for wonderful information on Alzheimer's disease. But I'm going to add to this list. There are 10 big warning signs of dementia. And there's differences between normal aging and how our brain begins to slow down in processing, as opposed to as compared to as a actual dementia diagnosis of progressive dementia. So the first one here would be memory loss that disrupts daily life. So that's very important because every day we have our normal activities and we don't have problems with that. But once something starts to impact our daily activities, our daily life, our functional abilities to do things, or cognitive abilities to do things, then that certainly is a big warning sign. Changing in planning or solving problems. And we talked about this in previous modules, or previous blogs, but we look at problem solving, or we call executive functioning. These are very high level cognitive skills that you do. It could be balancing a checkbook, those types of things, paying bills. These things become more difficult. Difficulty completing familiar tasks. So let's just say that's grocery shopping. That's something that we do on a weekly basis. And if we're having harder times putting that list together and actually able to go to the grocery store, not able to find items that we've been at that store multiple times, then that can certainly be a warning sign. Number 4 is confusion with time or place. So orientation, we get confused on where we're at. Maybe if we're driving to church or driving somewhere that we're familiar driving to, and now sometimes we get lost. Or forgetting very frequently in terms of time. Now, we'll emphasize on orientation, though, is most of all my patients are retired. Most of them are, and so I don't put a lot of emphasis on that. So think about it. If you're on vacation, you may not know the exact date, and that's okay. But if this consistently is a problem, then that is another warning sign. Trouble understanding visual images and spatial relationships. So that is what we call spatial orientation. So this is Again, dementia is not just a disease that impacts memory, so we actually are unable to have problems with differentiating how far an object is from another object. So let's take driving, for example. If you're approaching a car in front of you, the spatial orientation of how far that car is from you begins to be impaired with these individuals that are having some of these warning signs. Number 6 here is new problems with words or speaking or writing. So forgetting words, forgetting names. Yeah, and some people aren't the best with remembering names, but forgetting words, and what you'll see is an individual will talk maybe a whole sentence around a certain word when they could use one word to summarize that whole sentence. Next here is number 7 is misplacing things or losing the ability to retrace your steps. Number 8 is decreased poor judgment. Number 9 is withdrawal from social work and social activities. We see social isolation and an increase in depression in these individuals because they know something is going on, so they'll start to withdraw and make their world a little bit smaller. And lastly, and one of the most important ones, is changes in personality and mood. I see this with all of my patients, and this is something that is a big burden on the caregiver. I have a patient right now that I was talking with the family yesterday, and this is becoming one of the biggest challenges that they have as well. So I would summarize this. I'm going to add a couple more of these. So frequent memory lapses would be another piece of that. Forgetting just how to do things that you've always been able to normally do. Maybe an increased difficulty learning new material, and then repeating questions and conversations that you just may have had previously within a certain certain short time frame, maybe within a day or an hour or something like that. Indecisiveness, and I would say the next and the last one that I see the most out of patients is early warning symptoms of difficulty handling money or paranoia with balancing checkbooks, thinking that money is missing, thinking that people are stealing from them. Difficulty handling money is one that I see quite often. So I'm going to end today with this picture here of the normal brain versus the Alzheimer's brain. And we can see on this PET scan here that you have lots of red and yellow areas, and this is just your neuronal firing, the firing of the brain. And then you start to see the blue areas in here, which is normal. But what you can see here on the right with Alzheimer's disease is you can see more blue areas here throughout the brain, whether it's in the visual portions, whether it is in the personality portions or the language portions or the movement portions of the brain. So as we talk about all warning signs, what we can see is it really complements this PET scan very well, because you can see that it's not damage or neuronal death in one area of the brain that's impacting memory. You can see that there's everything from planning, social isolation, problem solving, memory, all these things that we normally do become impacted. So I hope this helps with some of the folks who've asked about warning signs with caregivers. I'm going to be talking about a couple different areas next week, and we're going to move on from Alzheimer's disease soon and begin to talk about Parkinson's-related dementias and vascular dementias, as well as frontal temporal lobes and other forms as well. So again, thank you for tuning in. Again, I'm really excited to see so much of the views that we're seeing across the board on social media. So we'll keep the weekly blogs moving, and everybody stay safe out there. Thank you very much.